And if you really want to take it a step further, I'd have you push down on me, push my shoulder down, push, relax. And then I can go just a little bit further, just a few degrees further. Hey everybody, Dr. Randy. I have Mark in the office. Mark's been a patient for some time. I have him on the decompression table now because a lot of patients have been asking about this, coming in for this. I wanted to show it in action. It's a great tool we have in this Irwin office. It's mainly for lower back and hip pain. So what this does basically is, Mark has a history of some low back pain, some irritated bulging discs. So for hip pain, low back pain, disc pain specifically, decompression is great because it takes the pressure off those lower vertebrae. So he's strapped in up top here. You got the neck roll. This is preventing his upper body from coming down the table. Then this lower belt is hooked onto the decompression machine, and it is pulling for 30 seconds, relaxing for 10. Pulling for 30 seconds, relaxing for 10. So essentially it's pulling his lower half, his hips, almost off his body, if you will. It's decompressing him along the y-axis, longitudinal axis, stretching his low back out. So you could imagine for someone like him, he's a machinist, he's on his feet all day long, how much compression and wear and tear we have on our low back. So this is really great for everybody, whether you're sitting too long, or whether you're on your feet too often, because over time, the compression of our lumbar spine starts to take its toll in terms of just pain, like I said, pain, disc pain, sciatica, herniated discs, stenosis, all those issues we use this table for in conjunction with his regular chiropractic care and some stretching, which we'll show you. So I wanted to just shoot this video so you could see actually, so if you're at home and you've heard about decompression, it's a great tool that goes hand in hand with chiropractic care, not just on its own. Because the stretching is great, but really when you combine it with the adjustments, it has a much bigger, almost amplified effect for low back pain. So he's set now, so we're gonna get him on the table and stretch him out here. So, okay, so we did decompression. I already adjusted him. Now we're gonna stretch his low back. And we're gonna do some of the basic ones that we love to do in the office for people with low back and hip pain. We can expand on this. We have a system that will email it to patients with specific low back protocols they can go through with videos they can do at home. So let's go over the basic ones here with Mark. First, we go knee to chest. Now, you can do this at home with a stretch band or with a towel, but it's a great first exercise to just open up the hip a little bit, sort of stretch his glutes, a little bit of the hamstring. The only thing is, and it's very important, if you're feeling a pinching up front, you don't want to do it because it could be a sign there's some arthritis or you're irritating something that we don't want to. So if you feel a pinch in the front of the hip flexor, then no, and stop it. You okay?
Yeah.
So I'm going to do this abbreviated for the video purposes, but normally I would hold this for 30 seconds to a minute. And I'm applying the pressure so the patient can relax the way I'd like to do it in the office. But at home, again, use a stretch band or a towel and do that. Then I would go 30 seconds, knee towards the other shoulder. And what I'm doing is I'm just applying some external pressure on the knee as I'm pushing down, keeping the knee tight to his chest. And he's getting a really good stretch. In fact, let's do it this way so they can see. Okay, so that stretch right there is really good for the piriformis back here, the glute med, piriformis, his QL, and his low back. So as the doctor doing this, I can really lean in and give good pressure. He can feel a great stretch through his hip here. Again, at home, use the stretch band. Now you can play around with this, so his knees go into his shoulder. You can even take it and go way over to the side and you get more of the low back, the SI. But, so knee to chest again, then knee to the opposite shoulder to get the piriformis. Then I would go 30 seconds each way. I would go into a figure four. So this leg comes up. Now bend this leg on the table. There we go. So now he's into a figure four. So he's getting a little bit of hip flexor here. He's getting more of his glute and piriformis stretch. And what we do in the office is just bring that complex up to really get a good stretch here. So this is one of the best hip low back stretches you can do. At home, I would leave the foot on the table again, take that, he can kind of just pull that to exactly just like that and really isolate these external hip rotators, glute piriformis, etc. Then after all that, 30 seconds there in the office, we do the straight leg raise. So this leg stays bent just to take pressure off the low back, and I'm gonna kind of keep his knee relatively straight. You can have a little give to it, and then with his foot on the shoulder, I'm just kind of go up and up and up. When do you feel a good stretch there? Right about there? You go more.
Right there.
So right there. So we want to go to the patient's tolerance level. I don't want to push past, and actually you can make it worse if you try to overstretch, but they should feel it, and it should feel like they're working. And if you really want to take it a step further, I'd have you push down on me, push my shoulder down, push, relax. And then I can go just a little bit further, just a few degrees further. Push down again, push, relax. So when he's doing that, he's engaging his hamstring. Then I have him relax, and I can take that straight leg raise a little bit further. So again, I'm gonna hold this for a minute. Then I'm gonna repeat on the other side. So I'll do it real quick again. So now this leg stays straight. Knee to chest, as long as you don't feel the pinching. Knee towards the other shoulder, and you're going to apply pressure either at home or in the office. We do it, and that keeps the knee tight to the chest to get the piriformis and glute med. Really good stretch for low back pain. And then figure 4. Now everything comes up. The whole leg can come up, or at home it can stay down. You can just pull the leg down, just like Mark was doing. Good flexibility, Mark. And then after 30 seconds of that, we're going to go into a straight leg raise. So again, the combination of the adjustments, the decompression, and the stretching, we found works wonders for low back pain. All right, good stretch on the hamstring, and that's it. Thank you.